New report released by the World Health Organization indicated that pregnant women in Yemen do not have access to proper medical care. This affects the well-being of mothers and newly born babies, especially amid collapsing healthcare system. This report has more details.
Even in the best of circumstances, childbirth can be a terrifying experience. But the humanitarian crisis in Yemen has made the road to motherhood more risky than ever. The health system has been destroyed by the country's long-running conflict. Only half of all health facilities are now operational. Every 2 hours, a woman in Yemen dies during childbirth. Pregnant and breastfeeding women are especially vulnerable during food insecurity. Mothers and newborns in Yemen cannot afford sufficient medical treatment due to poor living conditions and the deteriorating economic situation. In addition, malnutrition puts both women in childbirth and newborn babies at serious risk. Babies may be born prematurely and suffer from low birth weight and stunt growth if they survive. Stunting can have a long-term impact on a child's physical and mental development. Babies born to malnourished mothers are more likely to contract infections. Pregnant women and breastfeeding mothers face grave dangers when giving birth. Due to lack of access to vital healthcare and food in the war-torn region, these women face an increased risk of death and serious problems during childbirth. Pregnant women, breastfeeding mothers, and children are vulnerable in a country where over 20 million are currently without a regular food supply. Malnutrition is widespread in Yemen and further increases the demand and pressure for medical services. Less than 50% of health facilities across the country are fully functional. Those that are operational lack specialists, equipment, medical supplies, and medicines. Yemen's women and girls deserve peace. Increased international support and funding are critical to their survival. To spare the lives of innocent citizens, the world must act now.